Welcome back. Mpox, formerly known as monkeypox, has emerged as a significant global health concern, particularly following recent outbreaks in various regions, including Africa. This viral disease, characterized by symptoms similar to smallpox, poses unique challenges for public health systems worldwide. In this interview, we will delve into the implications of Mpox for Namibia, exploring the country's preparedness and response strategies. We'll also discuss the importance of public awareness and international collaboration in managing this infectious disease. We now have Mr. Nangombe, the Executive Director of Namibia's Ministry of Health and Social Services, to gain insight into the nation's approach to tackling Mpox. Mr. Nangombe, good evening and welcome.
Hi Nina, how are you?
I'm good, thank you, and I must add that it's very lovely to have you in studio.
Thank you.
And not telephonically. So thank you so much for being here this evening.
And I made time to come.
To start with, can you perhaps describe to us Namibia's current health security plan and its main objectives in a nutshell?
Yeah, basically the way in which Namibia is looking at the issues of health, public health security, is based on the lessons that we learned during COVID. We have learned that we need to be ready and have our systems for response and preparedness firmly rooted in the best practices. Mm-hmm. So as far as our ways of dealing with these public health threats, we have our surveillance systems in place. We have laboratory capacity that we established, including capacity for genomic sequencing. We have built isolation facilities so that should cases of infectious disease be detected in the country, we are able to treat and we are able to isolate these cases. We have trained our healthcare workers both for case management and also for diagnosis, so that in cases of outbreaks such as Mpox, our healthcare workers at health facilities are operating with what we call as the high index of suspicion. Mm-hmm. So if somebody comes to a health facility with symptoms that are consistent with symptoms of Mpox, for example, this person is quickly isolated. We take the samples, we send them to the laboratory, and we test to confirm whether this case is in fact what is being suspected. We have also put in place measures to be able to, for example, provide for medical countermeasures so that we treat either in terms of supportive treatment for these diseases and infections, or if there is a specific pharmaceutical product that is required, we should be able to have that. In the case of Mpox, of course, there isn't a readily available antiviral medicine. I think there's a medicine that was approved by the European Medicines Agency, but that specific medicine is not specifically or readily available in many areas. Mm-hmm. We, for example, also here in Namibia do not have as yet access to the Mpox vaccine. Mm-hmm. But as I indicated, our healthcare workers are trained to provide supportive treatment in terms of treating, for example, core infections that patients may have. But that is really where we are. So our surveillance system is in place. We have the means to receive complaints from members of the public. We have a specific toll-free number that the people may call. We have got surveillance capacity at our ports of entry, for example, so that we are able to screen those individuals coming into the country. And if there are suspected symptoms, we are able to pick them up.
Mm-hmm. Fantastic. Talk to us about what the ministry is doing in terms of enhancing public awareness around this disease.
We, again, learning from the COVID-19 lessons, we have what we call community risk communication and community engagement. Through this pillar, we are able to provide information, communication, and education material. We are able to send out messages through printed and electronic media, through social media, educating members of the public. Today we issued a press release on the Mpox outbreak, which, as we know, the Africa Centers for Disease Control declared as a public health emergency of continental security, and the WHO declared this as a public health emergency of international concern. So this triggers our engagement with our stakeholders to be able to coordinate our efforts in terms of educating the public. So going forward, there will be more and more messages coming out of the ministry to inform the public. There will be information shared on various platforms. We are going to send out our epidemiologists and other health professionals to engage with members of the public in terms of sharing the information so that the nation is aware. I think the enemy, the greatest enemy to fighting these diseases is misinformation. So we want to make sure that we do not leave space for misinformation, for fake news and things like that. And we are going to rebut aggressively those misinformation and fake news that are going to circulate, because we are engaging and encouraging the public to say, for your source of information, you must rely on information coming from credible sources such as the Ministry of Health and Social Services.
You mentioned, of course, earlier that in terms of medicine for this disease, we currently don't have that and we don't have any access to it. But what are the plans to be able to procure it?
Yeah, basically, the Mpox is known as what is called a self-limiting disease, meaning that a person who gets infected would get supportive treatment with other antiviral medicines or with antibiotics and things like that. And generally, people would get healed through this type of support. So basically, we know that, yes, the disease can progress, it can become worse, but in most cases, it is self-limiting. People do get healed when they get supportive treatment. And we know that the case fatality ratio for Mpox is about, what we have seen in the current data is about the highest that we have seen, or the average that we have seen is 3.5%, but we have also seen higher numbers or low numbers of case fatality ratio. For example, the case fatality ratio reported in Rwanda is 0 deaths. In other countries, it has gone up to about 11%. But generally, this is a self-limiting disease. It can be treated through supportive treatment at our health facilities, and people do get healed. As I'm saying, the specific medicine that was approved by the European Medicines Agency in 2022 is not broadly available at the moment.
What advice, just lastly, Mr. Nangombe, would you like to give the public regarding personal safety measures against Mpox, and of course advise them on what symptoms they need to be on the lookout for?
Yeah, so basically the transmission of Mpox is through fluids. So for example, if in terms of skin-to-skin contact with an infected individual, coming into contact with animal material from an infected animal, etc., etc. So, but in terms of protecting ourselves, we go back to what we have learned in the past in terms of making sure that we practice solid hand hygiene, in terms of making sure that we avoid crowded places, in terms of making sure that, for example, if there is a suspected case or if there's a confirmed case, you do not want to come into contact with items that were in contact with that particular infected person. So, for example, if it is maybe bedding or clothing or eating utensils and things like that, and also avoiding, as we said, close contact, skin-to-skin contact. This disease can be spread through, for example, sexual contact or kissing and things like that. So if a person is suspected to be infected with this disease, it is better to make sure that you don't come into contact with that particular individual or with the materials of animals that are suspected to be infected.
Mr. Nangombe, as always, it's a pleasure having you with us. Thank you so much for your time this evening.
You're most welcome.
We're going to take a brief break and the show continues when we come back. Stay with us.